Right. Thank you so much for having me. I'm Terralyn. I'm a genetic counselor that works with Dr. Landstrom up at CHOP. And I'm excited to talk to you guys today about genetic counseling and genetic testing and some special considerations when it comes to genetic testing. And the overall goal is to help you understand how genetic counseling and testing can support you and your family and to help you feel more prepared for your genetic counseling visit. So first, I wanted to start with talking about my profession. So many of you have maybe already have met with a genetic counselor or may meet with one at some point in your medical journey. So what are genetic counselors? We are healthcare professionals that have training in both medical genetics and counseling. And that means we are not only understanding the science behind genetic conditions, but we also know how to support you and your family in making decisions about your care. So our training includes a 2-year master's program, and we are board certified through the American Board of Genetic Counseling. And we work in many different areas of healthcare, from cancer, prenatal, neurology, pediatrics, cardiology, and many more. And I myself specialize in pediatric cardiology. Importantly, genetic counselors work closely with your doctors and different specialists to make sure that you are getting the best care. For example, I work very closely with Dr. Landstrom in our multidisciplinary cardiovascular clinic at CHOP. People often confuse us with geneticists. We are not geneticists or physicians, but genetic counseling profession was specifically developed to work alongside doctors and help bridge the gap between complex genetic information and patient care, especially as the field of genetics has grown rapidly in the last 20 or so years. So what exactly do we do and what can you expect from your genetic counseling visit? So genetic counselors can meet with you either in person or over video before or after testing has been done. So we'll ask you questions about your personal health history as well as your family history, and we may draw a pedigree, this family tree right here, and that helps us get a full picture of any patterns that might suggest an inherited condition. We'll also spend time discussing whether genetic testing is appropriate for you, and if so, what genetic testing options are available. And this is very much done in collaboration with the provider. We want to work together to make sure that we're ordering the right test for you. We'll explain the different types of results that could potentially come back on your genetic test and what those mean. And finally, we'll walk you through the logistics of testing, including how the sample is collected. So most genetic testing can now be done through a simple cheek swab instead of a blood draw. And then we'll also talk about insurance and cost considerations and turnaround time so you'll know how and when you'll receive your results. But the overall goal is to make you feel informed, supportive, and comfortable with each step of this process. We also meet with families after genetic testing has been done, so this might be more relevant for this audience. And we're here to say that we can still help after the genetic testing has been done. So we can interpret your variant in the context of your personal and family history, walk you through your genetic test results, discuss next steps, including what this means for family members, and also answer questions about inheritance patterns and reproductive options. And we can also provide resources, including connecting you to support organizations, whether there are any clinical trials, gene therapy down the line, and any research studies. So you might be wondering, how do I prepare for this visit? What sort of things do I need to bring with me to this appointment? And that really has to do with the personal and family history part of this appointment. So to make it simple, here's a checklist of what to bring to your genetic counseling appointment. This is specifically for the cardiovascular space. So first, we want you to bring any prior genetic test reports, and that's the whole report. We want to know what lab did the genetic testing for you and your family members and what the exact variant is. It's also very helpful to bring any medical records such as EKGs, echocardiograms, reports from your other cardiologists or providers, and your family history is especially important. We try to gather as much information about relatives who maybe have had cardiovascular problems, anyone that's had death, details about that death, if anyone has had a pacemaker or muscle weakness, and even better, bring any medical records from family members if that's available, even autopsy records if we can obtain that. Here on the side is a checklist of all of the family history questions that I ask every family coming through our clinic. So just things to kind of think about and get information about before you come to the visit. And finally, bring your questions. Think about what matters most to you. For example, what does this mean for my health? Or maybe what does this mean for my kids? We'll address all of these questions during the visit. So the rest of the presentation are common topics that I cover during almost every appointment. Granted, each appointment is very different, specialized, and tailored to the person sitting in front of me and their specific family history. But just wanted to go over some basic topics that I address with everyone. So what is genetic testing? Genetic testing is a way of looking at your DNA to identify changes, or also called variants, in specific genes, such as the element A gene. So I'll oftentimes pull up this diagram and try to walk you through what genetic testing is in easy to understand terms. And this is especially helpful for kids, but might be a basic review for some of you. So we have our DNA is this chain of letters in every single cell in our body. And the DNA is important for making a protein in our body that is important for a specific part of our body. So for the element A gene, it makes the lamin A and C proteins, and that's important for our heart function among a lot of other different functions. But if we have a spelling mistake in a gene, sort of like a spelling mistake in a sentence, this is called a variant or a mutation, it could cause that gene not to work properly anymore, not being able to make that protein anymore. And that can lead to specific health issues like an arrhythmia or a cardiomyopathy. So genetic testing is going to be reading through all of your genes to see if there's any of these spelling mistakes or variants that might explain why you have those health problems. And when you have genetic testing, there are a few different types of results that can come back. The first is a positive result. This means that a disease-causing variant was identified. And in this case, we often recommend genetic testing for family members, which is sometimes called cascade or risk predictive testing, to see who else may be at risk. A positive result may also lead to additional recommendations for your medical care if there are other associated risks. For example, if there's neuropathy, we may refer you to a specialist for that. The second type of result is a negative result. This means that no disease-causing variants were found. So this can be a reassuring result, but it's important to note that it doesn't always completely rule out genetic cause for your health problems. And because of that, clinical screening, like seeing a cardiologist regularly, may still be recommended for you and family members. And lastly, we can also get a variant of uncertain significance, or also called a VUS. This is a change that we found in a gene, but we don't know yet whether it causes disease or not. So these are very common findings when it comes to genetic testing because we're still expanding our knowledge about the genome and we don't know about every single exact variant quite yet. But it's important to follow up with a genetics professional who can help you interpret this uncertain variant. We take a very individualized approach to VUSs, and that may include testing other family members and also using some different research tools to try to find out if it's relevant for your care or not. Also, VUSs can change over time, so it may not always stay certain. It can be reclassified to a pathogenic or a benign finding later. And when talking about genetic testing and genetic conditions, there are two important concepts to consider, and those are called variable expressivity and reduced penetrance, which we've heard from the previous talks today. So variable expressivity means that individuals with the same genetic variant can have very different symptoms or different levels of severity. For example, one person in the family may develop cardiomyopathy in their 60s, and they might have mild symptoms, a stable heart function, whereas another person in the same family with the same variant might develop severe cardiomyopathy earlier in their life, and they might also have severe arrhythmias that require an ICD. And then you have another family member that might even have signs of muscular dystrophy. So it could be very variable. And one of the goals of the Leduc Foundation is to try to find out why this is. Reduced penetrance means that some individuals have a disease-causing variant, but might not show any symptoms at all. For element A-related dilated cardiomyopathy, we say that the penetrance is about 90 to 95% by the age of 60. So that means that most people with a disease-causing element variant will develop cardiomyopathy by that age, but not everyone will. And this is why we recommend cardiovascular screening for family members, even if they feel completely healthy or may not have any symptoms right now, they could develop it later. And some ask, what age should I consider testing my child for the element variant? And we say that the whole family should be screened at the time of the first diagnosis in the family, and because we have seen some childhood onset cardiomyopathy. So why does genetic testing matter? First, it can help you create a proactive care plan with your doctor, and this includes decisions on how frequent to have follow-ups, what kind of screening is recommended, for example, echoes, EKGs, cardiac MRIs, et cetera. And it also gives family members clarity about their own risks. So because of reduced penetrance and variable expressivity, family members might not know that they're at risk for health issues like cardiomyopathy. And it also provides information about risk to pass on a variant to children, which can be important for family planning. And finally, it allows for eligibility for future gene and precision therapies that are down the line, which we've heard a lot about today. And speaking of genetic testing in family members who may be asymptomatic or healthy, I often discuss the benefits and address common concerns when it comes to um, making the decision on whether that family member wants to do genetic testing or not. So some potential benefits to testing in asymptomatic family members is that it allows for early detection and monitoring, and it helps them develop a personalized medical care plan with their doctor. So then that family member can start cardiovascular screenings early and potentially catch any signs before symptoms occur. And next, it reduces uncertainty. It gives families clarity about their risk. So if the test is negative, that's reassuring, and they likely won't need a cardiology screening unless there's other concerns. And if they test positive, it gives them clear guidance on next steps. So either way, we have a definitive plan moving forward. Also, it is a decision to not do genetic testing too, and that is completely fine. You would just recommend that that person see a cardiologist regularly. We would assume that they're at risk until we have more information about their genetics. And here's some frequently addressed concerns when it comes to genetic testing in asymptomatic individuals. So the first is emotional impact. Learning that you're at an increased risk for health issues can cause a lot of different emotions for both the patients and their children. And some families would feel relieved to know this information, and others worry that the results may add stress or anxiety. And many families feel a combination of both. So it's very normal and common to have all kinds of emotions when it comes to genetic testing. However, we have found through studies and through our own experience that when families participate in appropriate pre and post-test counseling, they have less anxiety when it comes to genetic testing, and they have higher empowerment scores. And this has been studied and illustrated by this graph here, higher empowerment. When there's a disconnect or negative emotions around genetic testing, it's often because the family wasn't offered appropriate pre and post-test counseling. And then when doing risk predictive testing in children, sometimes we address the children's autonomy, which is their right to make their own decision about genetic testing. So we try to address this by engaging the child in the conversation if they are old enough to understand. It's usually around 8 to 12 years old. And I try to engage them in the appointment, educate them about what genes are. I'll probably pull up the diagram that I showed earlier. But at the end of the day, it's a decision for the family. So our team's goal is to empower families so that they can make the best decision for them, what feels best for them. Lastly, I'll frequently address insurance discrimination and privacy concerns. And that leads me to talk about the Genetic Information Non-Discrimination Act, or GINA. So this is a law that prohibits discrimination based on genetic information in both health insurers and employers. So health insurance cannot use your genetic information to determine eligibility or raise premiums, and employers cannot make hiring, firing, or promotion decisions based off your genetic information. This law does not apply to obtaining things like life insurance, long-term care insurance, or disability insurance, and it does not cover employers with less than 15 employees. And also, it does not apply to members of the U.S. military. So these entities are allowed to ask you if you've ever had genetic testing when you're applying for these insurances. However, this is important. So if we already know that there is a family history of a known variant or a known condition, genetic testing may actually help when it comes to things like life insurance or disability insurance. Because if we do genetic testing and we find out that you're negative, then we can show the insurance company that you didn't inherit the risk for the family. We can also provide a lot of resources at your genetic counseling visit. So I've listed a few here that would be relevant for this crowd. Of course, we have LMNA Cardiac. The second one I also wanted to point out is how to find a cardiovascular genetic counselor in your area. So it's really helpful. It shows a map, you enter in your zip code, you can find a genetic counselor near you. And actually, I'll go back. The last one has really great resources for how to talk to family members about genetic testing. So in summary, genetic counseling and testing can help us better understand inherited heart conditions, including those related to the LMNA gene. And it's going to help guide medical care for you and your family. Most importantly, you're not alone. So we're here to support you and your family every step of the way. And with that, I'd like to thank LMNA Cardiac and Priority and the Foundation.